Welcome to the Alcidion Insights Series. In-depth interviews examining workflow challenges and opportunities for digital innovation on the front line of healthcare. Join us to learn how Maya Precision can support your team. When you walk into a hospital today, what does data fragmentation actually look like for clinicians and patients?
If you're working in a hospital with data that's siloed, it's really, really difficult as a clinician because you spend your time looking through different records just to find the information that you need about the patient. So you'll be looking in one record for the demographic information, then you'll go and look in another record for the lab results. So you're unable to get the full information about the patient just on one screen or just in one record.
Data fragmentation is a real challenge day to day in clinical frontline practice. And that manifests in a number of different ways, but one way is broken workflows. So somebody can present into a different department or part of the organisation and the information's incomplete. Like some part of their journey or care has been done already, but unfortunately that doesn't stack up when they move to a different department. And so that broken workflow means that there's repetition from the patient's perspective. They get asked the same thing again. They have to tell their story again. And from a clinician or allied health professional, administrator perspective, it's work that's already been done that you have to repeat. It's duplication of effort.
Why do point solutions, however good they are individually, fail to solve the underlying problem?
Point solutions will serve a specific need or part of the pathway, but unless that information is stitched together into a longitudinal record or a single patient record, then it becomes siloed and separated. And so you get that experience of broken workflows, repetition, and information doesn't move around in a smooth way.
It's looking at things in isolation, and they are great, and that's where I think when I was working in a hospital and we got a new CIO, and he said it's a little bit like a cottage industry because all the specialties had their own systems because they worked the way they wanted them to work. They focused on what they wanted to focus on, but they weren't looking at things in totality. And that's where a patient, as I said, care delivery is a team sport.
What changes when a health service takes a platform approach to solving data fragmentation?
When we put a wraparound and have an orchestration approach to this data, it means that we can keep parts of the digital ecosystem that are working really well, but make sure that the data is converged into a single place. And that means that we can push the data into the part of the workflow where it's needed for that point, for that decision. So it means from a system user's perspective, I've got the information in front of me that I need to make a good decision. From a patient perspective, the experience is that I don't have that repetition of question. I don't have to tell my story twice. I actually land in a part of the pathway where they know why I'm there, what needs to happen, and it's a really smooth experience.
Can you give an example of what becomes possible when data flows freely across the organisation?
One example that from real life that is, it seems so simple but yet has such a powerful impact is that at one health service I know, they have a notification that goes out to whenever a patient that is being cared for by their palliative care team attends ED, the palliative care team are immediately notified. And such a incredibly sensitive stage of care delivery from a healthcare perspective, providing patients with that level of continuity is so important. But in having that data flowing freely means that the ED department doesn't have to take time out of their care delivery to call the palliative care team or to even remember to call the palliative care team. It just happens as an outcome of their workflow. They don't have to do anything extra.
If a healthcare decision maker is watching this and thinking, we've tried integration before, what would you say to them?
I was working in a healthcare organisation when we went out to market to get an integration engine, and we thought we were going to be really ahead of the game there. And it was interesting because at the time there wasn't as much known about them, and we had to explain to our finance director what was this going to achieve from the healthcare organisation's perspective. And he sort of translated it into, well, it's as if you're speaking French and they're speaking Italian, we can make them speak a common language. And that's what integration was look like in the initial stages. It was just making things join up. I think where people make the mistake is that they look at that point-to-point integration as the end point, if you like. Really, you've got to look at, well, what is the impact on the clinical workflow?